It's okay, Doc. I've said recording it.
Dr. Wairoto, I've seen the recording. I've seen. Before we get many people joining in, we are going just to do the photo. Let's just do quickly we do the photo, and then let's have our cameras on, we do the photos, and then we close. Sorry, before let me put my rights on. Let me do the photo. So Priscilla, whoever is doing the photo can do the photo. I think that's okay. That's done. Good.
Hello? Dr. Mutiso, I'm thinking we'll just go on. I'm trying to get my son to come and change the settings, because of school. These kids do very interesting things. So like now he's done something that he's not seeing, and he was using my laptop. His was spoiled. So, and yeah, but he's been called. He had gone outside. Let me hope when he comes I'll adjust this. But I can start. It's okay. I have a feeling maybe Mutiso is not available. And then we end at 7 sharp. I'll just give them, just like the way we've allocated, the 15 minutes, 5 minutes each person. Yes. Yeah, that's fine. That's okay. I'll do that.
What is wrong?
Video. Change it.
Okay. Noted.
Change.
Chill. Keep. You're unmuted. You can talk now. What do you know? What are you looking for? I can't invert it. I don't know how to. Unless I do. You don't understand.
Good evening, everybody.
At least that.
Hello.
Hi, Doctor.
Hi, I'm thinking we can start. But I think we have 1 more minute.
Yes.
Sorry, my video will remain off because we're having issues.
Okay, no problem.
Yeah. So how many people do we have so far? We have
21.
21. How many were we expecting? To see.
We didn't have an exact number.
Yeah.
Yeah.
So I think we can start.
Okay.
Yeah. So good evening, everybody, once again. I welcome you to the Kenya Psychiatric Association debate on the 5th of October. We want to listen to our candidates because we have people who have who want to take up positions of responsibility in our associations, and we need to listen. And as we make a choice before the election, it's to be good for us to hear what it is that they have in store for the association. I know we've just come from a tough time worldwide when we have had a very chaotic debate last week. So my hope and prayer is that this one will not turn out that way. I believe we'll all choose to be disciplined and listen to one another and have some decorum. So that's I believe will come from all of us. So Dr. Mutiso was to join me this evening, but unfortunately it looks like he's not available. So you'll have to make do with me alone, and probably maybe Dr. Jogona will chip in if it's when it's necessary. Again, just to remind all of us, we have 4 positions that are up where candidates have applied to help build our association and move it, take it places. I'm sure we all believe that Kenya Psychiatric Association we've come this far, but we can go farther. So I believe our candidates are prepared, and the reason why they vied and were vied for these positions is because they have something good in store for our association. So the 4 positions that are up are 1, the CME coordinator, which has 3 candidates who I'll be naming as we go along. The secretary position has 2 candidates. The treasurer position has 1 candidate, and the chair, I prefer to call it a chairperson, next time it might be a female. A chairperson position has 1 candidate. So we'll listen to all the candidates, but we'll put them in the groups depending on what they have vied for. I hope that is okay with all of us. So to start us off this evening, we will start with the CME coordinator position. This position has 3 people, that is Dr. Linda Nyamute, Dr. Edith Kwoba, and Dr. Lawrence Nderi. Can I first confirm that they're all here? Dr. Linda Nyamute, you're here? Okay, I've seen her waving. Dr. Edith Kwoba? Dr.
Yes, ma'am.
Okay, Dr. Lawrence Nderi?
I'm around.
Okay, all right. Yeah, so now with the 3 candidates, to be ladies first, I'll first have the ladies talk. Or do I have the gentleman first? Now that he's alone. Lawrence, can I start with you? Dr. Nderi? Dr. Nderi?
I'm saying,
yes.
Let's just, the ladies start. It's okay, no problem.
Dr. I was opting that now to change and have you start.
Okay.
Okay, so Dr. Lawrence Nderi is vying for a position of CME coordinator. Now, I'll give you 5 minutes. So your 5 minutes, and in those 5 minutes, we want you to tell us a few things that give us the vision and the plan you have for that position that you're vying for as a CPD or CME coordinator. So in those 5 minutes, you tell us a little bit about yourself and then tell us what's the vision and plan that you have. So note that you have 5 minutes. Remember, everybody else who's not speaking, kindly make sure you mute yourself so that we're all listening to one person. Let's assume it's a meeting, a physical meeting. So everybody else will mute themselves. And then we'll only have Dr. Lawrence Derry, who's starting us off this evening, telling us about his vision and the plan that he has as he vies for this position as a CPD coordinator. So over to you, Dr. Derry.
Hello, everyone. It's a nice thing to start. My full names are Dr. Lawrence Nderi. I work at Madari National Teaching and Referral Hospital. I don't know if I'm supposed to, I was told to talk about myself. I don't know if I'm sticking to myself professionally or a bit of social, but maybe just to say I'm also married and a father of 3. I hope that is enough in terms of my introduction. So yes, I offered myself for this position of CME coordinator.
Sorry, Dr. Adam, sorry to interrupt you, but probably just start off again also by telling us when you qualified as a psychiatrist. That would be important as part of your introduction. Thank you.
Okay. I graduated in the year 2018. That's basically about 2 years back, not so long ago. Still young in the field, but I believe vibrant. And looking forward to being one of the gurus in this mental health field. So, so yes, as I was saying, I offered myself to be a CME coordinator in KPA. I wouldn't want to purport that I have so much experience in terms of CME coordination, but I believe that Dr. Gitau and Dr. Wairoto, being the people who have been there, they have done quite a good job, and I congratulate them for the fact that they have brought KP in terms of CMEs. And I believe that we can take the association a step further. What I plan and what I see is I'm hoping that by the time, if I get elected, by the time this term is over, we will have been able to establish a CME department that is quite strong and vibrant and that has roots in all parts of this country. I look at what has happened during the COVID period. At least it has shown us that we don't really need to do a lot of physical meetings, which have been a challenge for most of us, especially those who have been working around towns. When you're told that we have CMEs in a hotel and you really have to rush through traffic, and sometimes you find that you can't even make it to crossover town. So what I was hoping to do is increase the number of meetings that we can be having so that we don't get to a point whereby we have doctors who are not able to get enough points. 50 CPD points is something that I believe we can achieve in a very short period. We just need to have many meetings. The digital platform has opened doors for us. We just need to create, to strengthen our digital platform and make sure that we have like a rota. We can be having CMEs with a timetable, like the way we used to do case conferences in campus. We know that maybe in the month of November, we have CME being presented by so-and-so. We can even create a rota whereby we have all psychiatrists presenting at these CMEs, and that way we will be able to make sure that everybody has the points. And also looking forward to creating a platform, a database, whereby even those people who are not able to participate in meetings or in Zoom, the webinars, debates, the workshops, we can be able to get this information much later, maybe through, you can come back and log into a database and check what was done, and maybe even if it means creating a few questions to make sure that people have actually gone through a seminar or a workshop. And then I was hoping that we could also get to a point whereby we even have like regional places whereby we have Koba and the team from Eldoret being able to host seminars from their side. You know, the way like KMA has divisions, we can have meetings from coast, we have the likes of Dr. Mombasa, we have Moikamba in Meru. They can be holding, we see a way, as KPA, we create a platform, and I've not been part of KPA. I don't know how much you have in terms of database, but I think by now they have acquired a Zoom account, and with that we can be able to actually help a lot of people in the counties also to be able to do this and disseminate this mental health information. Was hoping that we can collaborate a lot with people like this, the pharma industries. You know, we don't have to go looking for farmers to host us when we need to do workshops and seminars and Zoom meetings. With our own account now, we can have the pharma industry coming in, looking for us. It is us who are supposed to be giving them the platform on where to launch products, where to do CMEs. We should not be looking for them. So I believe that with the proper digital platform, we can be able to reach out to the social media. We will do the Facebooks and basically make sure that this mental health information gets out to the masses. I'm hoping that we'll be able to collaborate with other professional associations. There's no need why KPA cannot go to the corporate world. Go and talk to people like KCB and have KPA do webinars and meetings and workshops online. The KQ, the police, the schools. Those are the things that I'm hoping that basically we want to increase the visibility of the association. You see the association, I would say we've suffered from poor visibility compared to other associations. But through the CME, the workshops, the seminars, conferences, we can be able to create an association that is visible to the rest of Kenya. I don't know, I can see my time is up. Should I continue?
I think we will. We'll let you, unless you have one, we can give you 1 more minute to wind up if you haven't finished, so that we allow the other people time.
So yeah, the other thing I was thinking of is how we can collaborate, especially with media houses, and okay. We can have we have people who are good on TV, the likes of Chitai. They should always, we should have a collaboration with media houses where they can always be talking about mental health. And then we have things like the newspaper articles. We reserve places where the likes of Vatuoli can be writing through KPA so that we can increase our presence and we become more and more an authority in this mental health field. Thank you.
Okay, thank you, Dr. Derry. Thank you for your presentation. Members, you can put your question and answers in the chat, and then we'll pick them up and have a Q&A after all the presenters in each of the sections has presented. That we can have a Q&A. So place your questions in the chat. Our next presenter, now I'll go to the ladies, I'll pick one of them. So Dr. Edith Kwaba, you ready? Dr. Yes, Kwaba, you ready? Okay, we'll give you another 5 minutes. Just tell us what vision and plan you have for CPD or as a CME coordinator for Kenya Psychiatric Association. Over to you.
Thank you very much, Dr. Hinga, and thank you everyone who's joined us this evening. My name's Edith Kwaba. I'm a psychiatrist currently serving at Moi Teaching and Referral Hospital. I graduated with a Master of Medicine in Psychiatry in 2013 from the University of Nairobi, after which I worked for about 1 year in Kakamega, now Kaunti, before I relocated Eldoret, where I serve at Moi Referral Hospital. And one of my passions for the longest time has been to ensure that they increase access to mental health care. And by doing this, one of the aspects has been community education. So by offering myself as PPD coordinator, it's one of my passions to be able to enhance education in terms of knowledge. Mostly what I've been doing is education amongst even lay members of the population, like teachers, prisoners, chiefs, village elders. But at the same time, I've also been involved in training and teaching, especially primary healthcare workers, to embrace mental health and to be able to recognize it. And most recently, when COVID happened, I've been part of the KMA, KPA, CMEs, the webinars that have been happening every Tuesday. So I'm not new to aspects of webinars and hosting meetings. And I believe that's an added advantage. So what is my vision for the CPD department for KPA? And broadly, I want to say that the whole point is to enhance the standards of mental health care in Kenya through practical, innovative, and evidence-based CPD activities. I already know that there are CPD activities that have been going on, and we hope that they can be more practical, more innovative as we go along. And by innovative, what do I mean? COVID-19 has proved to us that we really don't have to travel, that we can now use Zoom and many other platforms. And I'm hoping that most of our meetings actually will be done on platforms that don't require traveling. And the importance of this is especially decentralization, especially for those of us who are not working within Nairobi. It has been a challenge when you do workshops and there's no permission to travel. And therefore, a number of people who are from outside the city have been locked out. But I hope that if I'm given this opportunity, I'll be able to ensure that most of the meetings, except when very, very important, will be held on platforms that can be accessed from the whole country. So decentralization would be one of the things I hope to do. And other than that, I serve in KMA, and one of the things we've always done is ensure that even the meetings where they are held is not only in Nairobi or in coast or in what we consider exciting stations, and we ensure that each division is actually mandated. Even the conferences, for example, in KMA this year, if it had happened, we would have gone to PC. And for some people, that may not sound like an interesting destination. But because every division, as it were, is encouraged to grow itself, to learn how to manage meetings like conferences, we travel anyway. And what we found is that there's always something exciting. So that's one of the things I hope we can do, that meetings will be rotational, like we do in Kenya Medical Association. And that for me would be something I'd want to see happen. And in terms of evidence-based, there's a lot of research going out there, and there's a lot of research going on in here. And sometimes we are not able to share what everyone is doing. And so two things I hope that we'll achieve is creating a repository for sharing information, so that all our research, I know the University of Nairobi, for example, more universities would collect information on their database, but we are interested in mental health work that's being done. So creating a repository where you can, at a click of a button, access what research has been done in the country, by who, including by people who are not necessarily KPA members. That's one of the things that we hope we can achieve. And the other thing that I hope we can to promote is not just bringing people to present in the CPD meetings who are already experienced, but also giving young people who are coming up an opportunity for mentorship and development. And where I come from in MTRH, we do quite a number of that. When you're doing research, we call it work in progress. So they are not presenting exactly refined data, but they're able to present what they are doing, and it's improved by colleagues. And I hope we can be able to do that for our postgraduate doctors, and for anyone else who is writing a proposal, for example, they're able to share and say, this is what I'm doing, colleagues, what do you feel about it? So that's one of the things I hope to do. The other thing that I'd want to do is to make it as practical as possible. We know that a lot of research and data coming out may not all the time be tailored to the needs of the Kenyan population or the resources that we have. And so we hope that most of these CMEs, we can say there was a paper that was published in the Lancet, but how would this paper then fit into our setting, given the resources that we don't have or we have? So those are some of the things that we hope can be exciting. So we are not being left out because we feel, for example, ketamine is not as readily available in Kenya and is being approved for management of depression, but we are able to tailor it to what we can do on the ground that's practical. So what would be the plan then if I got this opportunity? The first thing is to really assess the current status of the CPD program, and I believe that my predecessors would have done a good job. However, we want to always continue improving, and one of the best ways is to ask ourselves, probably develop a survey that we ask ourselves, you've been through the CPD program, what did you like? What did you wish would have been different? So that at the end of the day, we are able to improve with some evidence. So that's one of the first things I'd like to do, like develop a survey where we get feedback. And in that, then we're able to identify the gaps that exist, what has not been met over the years through the CPD programs, and also get suggestions from members. And that is very important, that it's not just I will get this opportunity who dictates what happens, but we'll be having views of those who will be our audience, the KPA members. What do they have to say about what they think should be included in the CPD programs? And what I also propose to do is that to have like a yearly plan, a work plan, for example, so that by the time you're setting out, you know that members previous year, by the time you're closing the year, you have an idea of what people feel should be discussed in the next year, and you're able to come up with a clear program of what you want to do. Even if you don't meet 100%, at least you're meeting the needs of the people, and you're not just giving people information just because it's available. Of course, that is coupled with a lot of partnership to ensure that as many meetings are possible, so that we get as much knowledge as possible. And going with that also is evaluating, so that at the end of each year, it's good to look back again and evaluate. So we did it this way. How have we done? Are we still where people wanted to be? How do we keep getting better? I think mostly that's what I'd want to do if I'm given this opportunity. And I thank you for listening, and I hope that you give me your vote. Thank you very much. Back to Dr. Hinga.
Thank you very much, Dr. Edith Koba, for telling us what you hope to do if you get elected into this position of CME coordinator. Just for those who are joining us, we have 4 positions that are up for where candidates have applied. That's a CME coordinator, the secretary position, the treasurer position, and the chairperson's position. So we are currently listening to those who have applied for the CME coordinator. So we've already listened to Dr. Lawrence Nderi, and we've just listened to Dr. Edith Koba. And now we'll be moving on to the 3rd candidate, who is Dr. Linda Nyamute. I hope you're ready, Dr.
Yes, I have, Dr.
Yeah, and I'm asking everybody else who's not speaking, kindly mute so that we become clear for all of us. Kindly mute your microphones, and let's only have the person who's speaking being heard. Thank you.
I can go ahead. Okay. So yes, as introduced, my name is Dr. Linda Nyamute. I am one of the youngest psychiatrists, I assume, but nonetheless, very well driven. I currently am in private practice, but soon relocating to Isiolo County. Yeah, I think that's basically just about me. I know some of you may be surprised to still see me here. Initially, I had a plan to move to the UK, but I looked at the whole situation and I had a few conversations with a lot of my mentors and figured I'd do a bigger change, giving back to my community, a community that raised me. Yeah, so why me as a CME coordinator? First and foremost, I'm very curious. I'm a very curious individual. I love to grow my knowledge bank. So reading, learning, and as well now pulling people into that perspective as well, to just create the knowledge bank, become better individuals in terms of the kind of care that we provide to the patients that we see. So the other thing is, I think I'm a leader. Yes, and so I'm able to coordinate events, I'm able to coordinate webinars. I also have an online platform where we're doing mental health awareness for the general public, and we do weekly webinars for every 3 weeks, and then we take a break. So yes, I have done coordinated and planned and run webinars. So it's not something new for me as well. Yeah. So, and I also know how to delegate duties so that I don't get overwhelmed when things are too many. Nonetheless, I'm also very good at multitasking. I'm a very good multitasker. And no, I'm not a tasker. I'm very good at multitasking. I'm also a good team player. And as I said, I'm very well self-driven. So when it comes to my vision, what I plan to do, during the time for COVID, we don't know how long this whole restrictions will take. So of course, we'll keep in line with the online webinars, but not make them too frequent as well, because we can get webinar fatigue. I know a lot of us, at one point, the webinars became too many and so overwhelming such that the participation becomes low. So they are present, yes, but not to do an evaluation so that they are not overwhelming as well and getting webinar burnout. Yes, post-COVID, there's a whole different feel when we gather around and we are together. So I think in as much as we've embraced the online Zoom platform, physical meetings also have a different touch to them. So I think alternating physical meetings and online webinars will also be a very good idea. Yes, or rather, it's part of my vision. Yes, and of course, we'll make the physical meetings available online for those who are not within the town or within the vicinity to be able to access the webinar. And then, yes, so my focus will be on 5 key areas: physician mental health. My research in postgrad was on burnout, particularly among medical students, and I was quite intrigued about that. So I feel like it's been a neglected area for a while. We need to focus on the physicians because we're the ones providing care, and sometimes we also forget about ourselves, the psychiatrists. So physician mental health, regardless of the specialty. The second thing to focus on, abandoned areas. Old age, sorry, I don't know why I'm very nervous today. I'm usually not this nervous. But yeah, so abandoned areas, old age psychiatry. We've not had a lot of webinars on old age psychiatry, child psychiatry, special needs. Those are kids with intellectual disabilities, the LGBTQ community. A lot of us, when we meet patients who are in these categories, we panic, we don't know what to do sometimes. So I think this is an area that we also need to dig into. The third thing is to liaise with other disciplines. So mental health in neurology, mental health in surgery, mental health in cardiology, yes, and the list goes on and on and on. The fourth point to focus on will be medical education, particularly the aim of this is to try and mentor medical students so that we can increase our human resource in psychiatry. Yes, so just liaising with the student associations. I think every university has a student association. So half yearly or once every year, we have like I wouldn't want to call it a career day, but something like a career day where we get to talk to them what is psychiatry all about, so that you can encourage more and more people to pursue psychiatry so that you can try and reduce the mental health gap in the country. Yes, the fifth and the final point is continuous public education. Actually was hoping that KPA could open up this as a post by itself, because I think we are very within the mental health field. We're really trailing behind in terms of our visibility, providing information for the public. We have a very curious public, and information out there sometimes is not reliable. We have so many mental health advocates coming up and mental health champions, and a lot of them are probably patients who've lived with an illness or a caregiver, so they will give their experience. Sometimes the information may not be as credible as it should be, and I feel like as an association, we should be taking the lead in this platform. So whether it's digital, through social media platforms, or down on the ground, in keeping with COVID guidelines, I think it's an area that really, really needs to be focused on. And because we did the May Mental Health Awareness Month last year under Dr. Kingi, and this year under Dr. Chitai, and it was a very exciting period. We disseminated so much information to the public, but the unfortunate bit is once the May Mental Health Awareness Month ends, KPA is silent, waiting again to be heard again next year in May. So I feel like to increase our visibility, consistency is key. So this is our field that we really, really need to look into and give in more than we are at the moment. Yes.
Okay, thank you.
That's it for me. Thank you.
Okay, sorry. Thank you, Dr. Linda Nyamuta. We've heard now from the three candidates. That's Dr. Lawrence Nderi, Dr. Edith Koba, and Dr. Linda Nyamuta. I would encourage those who are able to ask questions directly. You can unmute and ask the candidates a question. I'm trying to look into the chat and see whether there is any direct question for the CME coordinators. Meanwhile, anybody who wants to ask the candidates a question, you can unmute and ask. Anyone? KPA members, anyone who wants to ask the candidates, our three candidates, for CME coordinator a question or clarification? The question I'm seeing on the chat, I'm not sure it's quite, it's for the CME coordinator, but it's a question to all the people vying. Well, this one I think will be answered by all the groups. What do they do to ensure that mentorship takes off in this association for younger psychiatrists and for registrars? I think we can ask these questions towards the end as we also listen to the chairperson. Any direct question to the CME coordinators, members? As you think of one, I have one for the, one question. One time, about a year, there was a CME coordinator a few years ago, and a question I'd like to ask them, which any of them can answer, is most of the time we depend a lot on the pharmaceutical companies to fund our CMEs, especially when we have physical meetups. How else can any of the CME candidates tell us how else can we fund this when COVID is over and if we go back to physical meetings? How else can we do this besides having virtual meetings? Any of them can answer. Dr. Nderi, Dr. Koba, Dr. Nyamuta, any of you could answer that?
Okay, I'll go first, if that's okay. We were considering a walk, mental health walk, but okay, well, COVID happened. One of the things during walks is just like the Standard Chartered Marathon and things like that. A lot of funds can be created during such events, and I mean, from just donor contribution, that people who just be willing to give in and contribute, the sales of merchandise, t-shirts, wristbands, hats, umbrellas, and yes, name it. So I think that's one key area that I don't think we've really dwelled into, and I think it could be a good place to source for funds alternatively from other than the pharmaceutical companies.
And Dr. Higa, if I could add to what Dr. Nyambuti has said, I think I've seen quite a number of announcements, funding opportunity announcements to fund like a workshop. And one of the interesting things would be to explore such grant writing opportunities. Some of them are not very complex. You just need to have a goal and something that's impactful for your meeting. That's one other thing that we could explore. The other thing is that we have hospitals. Other than the pharmacy, we have private hospitals or even public hospitals. I've seen Moi Teaching and Referral Hospital, for example, sponsor workshops. So we need to begin to explore local communities. Yes, back to you, Dr. Henga.
Hello. To add on to what they have already said, I believe as KPA, we can foster more collaboration even with the corporate world. I believe once we have strengthened we get more partners, people like Safaricom, Equity Group. These are people who can be able to at least fund us and help us mobilize resources. Again, I think the other thing we've had is I think that our numbers are growing in terms of even the psychiatrists themselves. What we've had previously, I think the sense of ownership of the association has been low. So I think we need to make it a little bit more enticing for people so that we can have people pay membership fees and the subscription fees. I think that will also go a long way into increasing our resources. So let more and more people be KPA members, apart from also creating external partnerships. Thank you.
I'm thinking in the interest of time, I think we'll move to the next position. But if we have time towards the end, we can still ask more questions. Our next position is the position of secretary. And this position has two candidates. That's Dr. Florence Jaguga and Dr. David Wairoto. I hope you're both here. Dr. Jaguga, you're here? Oh, I was told she sent something for us to get some information from. Okay, then Dr. Wairoto, you're here?
Yes, I'm here, please.
Okay, so maybe we'll start off with Dr. Wairoto, who is here to tell us what is his vision and plan to advance the KPA Secretariat. Dr. over to you.
Okay, thank you so much, Dr. Hinga. So my name is David Wairoto. I am a psychiatrist. I graduated in December 2017. And I'm currently a lecturer in the Department of Psychiatry and Mental Health in Kenyatta University. So thank you so much for attending this debate. Currently, I am the Vice CME Coordinator of Kenya Psychiatric Association, and I've held that position since 2017. And I thank you members for actually voting me in. So basically, what I'm going to do for the organization and the position which I want to vie for is for the secretary. My vision is to articulate, communicate, and advocate KPA's agenda to our members, who are you. Also, I'm going to communicate to the public, also to stakeholders, to the government, and also NGOs and any other partners. And how I'm going to do it, the first thing is I'm going to increase KPA's visibility. As some of my colleagues has mentioned, we are there, but usually in the background. So we have our members who are very good with media engagements. So we are going to actually organize for training for our members to be able to engage more with the media, with TV and radio, and also with the written media, just like our senior member, Professor Atuli. Secondly, I plan to establish a welfare fund for our members in case someone falls sick, in case someone unfortunately has a demise in their family, and we are going to form a welfare committee, which will be chaired by one of our senior members to help us actually plan on this. I'm also going to encourage that we promote sustained relationships and collaborations with local and international bodies. Currently, we have some with City Rises, we have some with KMA, and the other professional medical associations. So I want to strive to actually partner with more associations and stakeholders so as to increase KPA's visibility and to be able to drive our agenda. Secondly, I plan to actually collaborate with our members to start a research division in KMA to mimic the one at the Kenya Pediatric Association. We have many good researchers, the likes of Professor Atoli, we have Professor Madai, we have Professor Ndetei, and Dr. Kokonya. So we are going to tap, and even our own Dr. Edith Koba. So we need to tap on their talent and actually start a research division, which will actually mentor our young members who are the registrars and also our senior members to collaborate on more research activities. I'm also going to plan to do more community engagements as a secretary together with the NEC members. I was suggesting that we can start doing similar engagements like the Kamili Foundation, where we identify facilities in the community which don't have any psychiatric coverage, and we can be able to actually go to the communities and be able to offer psychiatric specialist services at a minimal or no fee. And then we partner with our drug companies to be able to avail medicine at a cheap or even very minimal cost, just to try and actually bridge the gap with psychiatrists, because we know we are very few. We're only 116, serving the whole 47 million population in Kenya. So we need to actually reach out more to the community. The next thing is currently we have a full-time office admin, and we need to use the full secretarial services. So we are going to offer members full secretarial services. Members have been asking a lot for letters of reference when going for maybe applying for private practice, or referee letters when going abroad. So these full-time services will be available for our members free of charge at any time, of course, during working hours. The next thing I want to plan to do as secretary, we need to actually reach out to our registrars, and I plan to come up with a program called Adopt a Registrar, where as the consultant psychiatrist, we are going to pick at least one registrar who we are going to mentor, we are going to follow up on, and be able to actually show them the ropes, as I was shown by some of our senior colleagues, to be able to now do a very good psychiatric practice in Kenya. Nextly, I want to also, just like Dr. Linda, to start collaborating with our junior colleagues who are actually in undergraduate. We partner with organizations such as AMSUN to try and actually now reach out to the undergraduates and be able to influence many of them to apply for psychiatry as a postgraduate course or as a specialist course, so as we can increase our numbers and actually bridge the gap of having very few psychiatrists in Kenya. Wow. Then what I also want to do is I want to collaborate with the ministry and other bodies which are responsible for policies, so we can be able to develop guidelines and protocols. We are having some challenges, especially in things like forensic, where we don't have anything written down. So we need to actually now develop such protocols, and as KPA, we can spearhead that, but of course collaborating with the government and other organizations. And then what I also plan to do as a secretary is to start a recruitment drive. We have many psychiatrists who are not our members and who have not actually paid subscription charges. So we need to actually talk to our colleagues and be able to actually encourage them and let them see the benefits of joining our thriving association. Then lastly, what I also want to do, I want also to offer a free marketing through our website. I'll be able, we of course with our developer, we'll be able to offer free marketing services for our members who are in private practice, so they can be able to have their details, their office details on our website, So it can be very easy for them to actually get referrals from our website and be able even to make bookings. So we just need to incorporate that in the website, and we can make bookings for you in the clinic using the virtual platform. So thank you so much for your time. Back to you, Dr. Hinga.
Okay, I think Dr. Hinga is a bit off, but we can go through.
Sorry, you can hear me now? Sorry for that.
Yes, we can hear you now.
Oh, sorry for that. Yeah, thank you, Dr. Wairoto, for your presentation. Dr. Florence Jaguga is not with us this evening, but she sent some communication. So I believe Priscilla can share us the screen, or at least give us the information of what she wanted us to hear this evening. Over to you, Priscilla.
Yeah, so I'll just do a run through of what Dr. Jaguga had said. Are you able to see what's on the screen? But I'm going to voice over it pretty fast. That's okay with everybody. So she greeted all. Dr. Florence Jaguga is a psychiatrist working at Moi Teaching and Referral Hospital in Eldoret. She's also vying for the secretary position at KPA. The secretary position is a vital role in any organization, as it is key in ensuring that the meetings are effectively organized, the records are well kept, and correspondence managed in an efficient and timely manner. As an organized, committed, and reliable person, she believes that she possesses the skills necessary to fulfill the very important administrative roles in this office. In addition to her experience as secretary to a number of committees at the hospital, MTRH, this has helped her gain greater insights into the role of a secretary. If elected into secretary position, she plans to maintain a meticulous record of the association's events that is accessible to all members. Her top priority will therefore be to digitize the association's documents by setting up a cloud platform to store the information. Secondly, in order to promote the dissemination of research conducted by members and also to promote evidence-based practice, she plans to set up and maintain a database of research work done by psychiatrists in Kenya over the past decades. Such a database will additionally be useful for connecting potential research collaborators. And kindly mute your microphone, tafadhali.
Sasa tulipitia haba exchange nini
Sorry about that. So I can continue. So she believes that forming partnerships and collaborating as one of the guiding principles of the KPA Strategic Plan 2019-2024 is a key role of the secretary. If elected, she plans to foster both internal and external partnerships with a diverse set of stakeholders. Her involvement in the World Health Organization Quality Rights Initiative, as well as membership to the Basic Needs, Basic Rights Board, has helped her create connections with the mental health space that will be useful in increasing the visibility and the impact of KPA. Finally, if elected, she will fulfill the responsibility of Secretary to KPA to the best of her abilities. Thank you. So that's it from Dr. Jaguga. Hello, we're done.
Can you hear me?
Yes.
Okay, thank you very much for that communication. So that is what Dr. Florence Jaguga wanted us to hear this evening. So we've heard from both Dr. Florence Jaguga and from Dr. David Wairoto. I don't know whether we have any direct questions. Anybody who wants to ask a question directly, you can unmute and ask. We probably now need to ask only Dr. Wairoto, who is here with us. Anyone with a question? You're all quiet this evening. Anyone with a question? Okay, if there's none, I think we'll move on. Hopefully we'll have questions towards the end. Now, our third position is the position of treasurer. Treasurer position has one person, who is Dr. Mercy Karanja. Dr. Karanja requested that her video will be off, but she's here with us. Dr. Karanja, you can hear us?
Yes, I can.
Okay, so Dr. Karanja, you vied for the position of treasurer. Kindly, in about 5 minutes, tell us what's your vision and your plan on KPA in terms of resources, mobilization, and finance management of Kenya Psychiatric Association. Go on, Dr. Ari.
Thank you, Dr. Hinga. Good evening, everybody. As stated, I'm Dr. Mercy Karanja, and I must say I feel very old because all the other people seem quite young. I am a psychiatrist now 10 years this December, having graduated from the University of Nairobi in 2010. I guess my 10 years of experience may come in handy when we come together with a younger team. And I've been working in the Ministry of Health mostly. Currently, I'm assigned as the National Focal Person for Substance Use Management at the Division of Mental Health. And I also work at the Madari National Teaching and Referral Hospital, where I'm the technical lead in the substance use management, specifically at the methadone clinic. I also serve part-time as a consultant with the UNODC and various NGOs in the implementation of programs for people who use drugs. I consider myself an advocate for mental health and a quality rights champion. So I am this evening vying for the position of treasurer, and I want to first thank the organizers for giving us this platform to interact with the members before we go into the elections. And I'm also happy to have been nominated by some of you, and that my application was also accepted by the current KPA NEC. Well, I guess the reason I'm alone in this, maybe sitting here debating by myself, is because the position of a treasurer in any association is never easy, but I believe that I'm up to the task. I may not have a background in finance, but I believe that I'm adequately equipped to perform this role with the support of my colleagues, my fellow colleagues in the NEC, as already alluded to by the other people who have spoken before me. It's definitely not a one-person show, even when it comes to financial matters for the running of the association. So we'll have to work a team. And I'll definitely endeavor to learn more about financial management so that I can be resourceful to the NEC in the strategic thinking on the financial matters. One of the strengths perhaps I can draw from is sometimes back in 2016, I took leave from the government and worked in an NGO full-time. And one of the biggest lessons I learned was how these big international organizations and NGOs manage to stay financially afloat through grants writing and always taking advantage of what is the current focus in the medical field. So I think that is something I'll bring on board to the NEC by helping them us think strategically on where we can draw resources from. I am a team player, and I am trustworthy, so and I'm very attentive to details, so there'll be no zeros missing from the financial reports that will be presented at the end of the year. And I'm not shy to take up new challenges, so I feel I'm suitable for this position. Well, one of the reasons I want to come on board is that the KPA strategic plan needs a lot of financial resources for it to be to accomplish the missions and objectives. And one of the main focus and the missions I want to bring on board is improved financial resource mobilization, and beyond the usual tasks of a treasurer, that is include financial oversight, planning, budgeting, and reporting. So I will focus on how can we raise more funds to ensure that we're able to meet the objectives and missions of KPA, as we also maintain integrity and of course operating within the existing legislations that govern the association. And well, what I have seen is that the previous teams have done a lot, and they've done an excellent job. And I first will of course, wish to draw from their experiences so that we can forge the way forward on financial matters. And one of the things I've noted is that from the available reports over the years, financial reports, we may have stagnated a little bit on the way we raise funds. And hence, moving forward, one of the things we need to think about, and I'm happy to hear that even my colleagues who are vying for the other positions are thinking around this, what is the most strategic way to meet the financial obligations that are needed to achieve our mission? And off the top of my head, I've been thinking that there are so many opportunities currently available that we need to take advantage of. And even when you read through the KPA strategic plan, you see in the slot that what is listed as opportunities is quite large. And just to highlight a few is the recently concluded mental health task force was actually brought about by the top office in this country. The presidency saying that we need to focus on mental health. So we need to take, as the highest levels of professionals in this field of mental health, we need to be on the front line in engaging in mutual partnerships with the government to address this crisis. And what I see is where we can look for funding opportunities, for research, capacity building, program implementation, and technical advisory roles, amongst many more. So we need to form small subcommittees within our KPA association, so that as the NEC, we delegate this, we identify the persons who have these strengths, and we ask them, can you look for funding opportunity for research, capacity building, program implementation, as we support the government to fulfill this agenda that it has now created on mental health. Then also other things like offering ourselves to the other organizations, like giving workplace mental health packages to an organization. As KPA, if we did that, they can actually bring more funding to the organization. And I think when we remember correctly, when the HIV scourge, came to Kenya, some of the fortune befell some local medical associations like the Kenya Pediatric Association. And I think it's our turn now to take advantage of that, just like Dr. Wairoto stated earlier. Can we have a subcommittee that actually now focuses on how we are going to be funded to do some of this work on behalf of the government. The second area is thinking of digging deeper and reaching out to ourselves. Sometimes the solutions, we look for solutions very far. Dr. Nderi has stated that we have not, as much as we are seeing a positive rise in the number of psychiatrists in the country, I don't think it's commensurate also with the existing paid up KPA membership. Maybe the question now we need to ask ourselves is, are we making ourselves attractive as an association for young psychiatrists, for those working outside Nairobi, those working outside Kenya? So I want to work with the NEC to create a package that will be attractive to members. We come up with packages that will be attractive to members so that they feel the need to join the association. And the benefits of joining the association will be beyond just getting conferences and CPD points. It could be more to even reaching into enhancing the staff welfare so they feel more included, forming subcommittees that make them feel valued and they can give input to KPA. So that somebody like Dr. Nderi said, he has never been a part of KPA before, everybody will feel ownership of the association, and then they feel the need to pay up because they can see the benefits. And then we also identify within ourselves, we've seen events that are sponsored by members of KPA who are philanthropic. So can we reach also within our own selves and identify people who are in private practice who can actually sponsor? We don't always have to run to the medical reps and pharmaceutical companies. I think the key thing, and the third thing I want to reiterate what my colleagues have said, is improving our visibility, improving our partnerships and collaborations. If we are more visible, more people will want to work with us. If more people work with us, now we'll no longer be the ones we are no longer be the ones who will be looking for them. Can you sponsor this? They are actually the ones who will be coming and looking for us. So we need to find out what are these. We need to look for partnerships. And there was one suggestion by a member in the WhatsApp group to hold golf tournaments. We can do walks. We can have branded merchandise. We can have online platforms where we give mental health awareness, that all those will make now more and more companies want to work with us. You know, mental health is not managed in ICU like pneumonia and malaria. It is managed mostly in the community. So we need to go and interact more with the community and be visible, so that if there's anything to do with mental health, KPA is a to-go-to association, and thus our resources also become automatically increased. So we need to look for such package. We'll need to develop packages that reach our professional bodies and can be accessed either through our website or other platforms. Then, of course, we also need to do some CSR activities. I don't know whether KPA, I know there's some few activities that are done, but even when we do the CSR activities, are we really visible? So moving forward, if I do get to be the treasurer of KPA, I will of course have a briefing with the existing treasurer who has done an excellent job, and of course the secretariat. Mapping, we need to do mapping of our existing partners and broaden those partners and identify more partners, have a financial plan that supports the strategic plan, engage the membership of KPA on ideas on how to further improve resource mobilization, because this is not a job for one person, it's all of us to come together and describe what we need to do to make it work and get the resources. And if the KPA constitution allows, we can perhaps even have a subcommittee that is committed specifically to resource mobilization. And I believe if we do that, we are able to access more resources that are going to improve our strategic plan objective achievement. Thank you so much for giving this opportunity to speak. Over to you, Dr. Hinga.
Thank you very much, Dr. Masika Ranja. I'm sure you have all listened to her. We'll allow for questions at the end. I think we need to allow our final speaker, who is the chairperson, person who vying for the chairperson, and then we can have the questions on the chat, or for those who want to ask direct questions to our candidates. So over to you, Dr. Boniface Chitai. You're the last but not the least. We want to hear from you. What is your vision, your plan for KPA? How will you transform KPA to be a successful professional association? Over to you, Dr. Chitai.
Okay, thank you very much, Dr. Hinga. I would like to start by thanking all the organizers of this debate under the leadership of the chairman, Dr. Njuguna. I would like to thank all our members who have attended this session this evening and for staying with us. I also want to thank all those who are not psychiatrists. They could be mental health professionals or fellow mental health professionals, or members of the general public who are interested in mental health, or advocates who have joined this debate this evening. We are very happy and we feel privileged to have you. I've listened to my colleagues and I thank them for offering themselves for the various positions. And I already feel that we are going to have a great team to work with in the National Executive Committee of the Kenya Psychiatric Association. There are very many good ideas that we should harness our energy towards implementation. And vying for this position, I'll be privileged to work with you either within the National Executive Committee or as active members within the broad space that we have in this association, and your contribution is needed. My name is Boniface Chitai. I'm a psychiatrist who qualified in 2018 from the University of Nairobi. I'm a consultant psychiatrist with the government at Odaya National Teaching and Referral Hospital, or the KNH Annex. I've been a member of the KPA NEC for the past 1 year, and during that period, I've been privileged to be part of the process for the development of the KPA Strategic Plan 2019-2024. I've also been privileged to be part of the leadership for the development of the new KPA Constitution, and also led the May Mental Health Awareness Month 2020, as well as participating in previous awareness activities. A lot has been said, and maybe as the last speaker, I would not want to repeat a lot that has already been said, but I would like to emphasize that KPA aspires to become a leading professional association in mental health globally, and that's a huge challenge. It means that we must keep improving what we already have. And so we will be moving to look at the strategic plan that we already have so that we don't reinvent ideas that have already been put down to paper. The past leadership did a great job in developing a strategic plan that is very ambitious and forward-looking, that if implemented, indeed, our association can become a leading professional association. Starting inward to outward, perhaps because it is a psychiatric association, we will want to improve our engagement with our members, make our communication with our members regular, get the members involved in the activities through the subcommittees that we've had. And the Constitution does not give a prescription of the committees, but these committees are developed according to our needs as an association. With regard to the question of mentoring our young ones, we believe that we are as strong as our youngest members, the affiliate members who are the registrars in training. And we may need to begin by even sensitizing them about the process of mentorship, because mentorship also involves initiation of activity from the person who is being mentored, and it's important for the mentors to understand their role. And they will learn by participating in the activities that are happening, and how will they know unless they are well informed and communicated. And it will be important for us to think about even having a focal person who can directly communicate information to our registrars, get them involved in the activities, assign them roles so that they can, they can pick up, they can feel the ownership with this association. We've had something about KPA and other associations. So the other health professionals in Kenya and the KMA, there's a great partnership going on. And this partnership has been anchored around improving mental health and psychosocial support for health workers in Kenya. And this is something we can leverage on together with simply increasing the mental health literacy of health practitioners in Kenya, because in the past, we've had a problem of also just the way we have low mental health literacy in the community. We also have low mental health literacy sometimes within the health professionals. And so it will be our role working with other stakeholders like government to ensure that we have improved mental health literacy. And these are activities that we can actually do, carry out and monitor. With government, already mentioned, our focus should be on ensuring that all the many good documents that government puts up or establishes or even participate in drafting are implemented, so that we don't repeat the same processes of developing guidelines that are not implemented. And so the most recent being the mental health task force report, a great report, and we wanted to be leading the advocacy process in having this implemented, because if this report is implemented, it's going to change the face of psychiatry and mental health in Kenya, and this is to our interest and also the interest of Kenyans. There are a lot of things also working with government that we've written in our strategic plan and which we want to follow through and implement, including doing position papers regularly on current and emerging issues. And this will be very important for us to look into ways of doing them. And this work will be done in collaboration with members, as it's been stated that our members are gifted in a lot of these areas and they have the capacity to help. With regard to partnerships with the other organizations that are working within the mental health space, this is a growing space, and the danger is that there may be confusion as the space continues to grow. We may fall victim to even quacks infiltrating the space, and when quacks infiltrate a space, what they will do is to discredit and create, we'll have credibility problems. So KPA should also take the lead to identify who is working in this space, work with the other non-organizations to establish who is working in this space, at least we need to have this information and share it out, also aware. And apart from just identifying, probably participating in the process of creating lists of who is an advocate in Kenya, for example, we can also establish awards of those who are doing well in this mental health space, so that we can encourage them, those who are doing, can encourage those who are doing a good job. And with regard to the public, the members of the public, again, it's in our interest that we educate the members of the public about mental health. And the best way to do this will be through strong partnerships with the media. And this will be an area that may also require a separate strategy, a communication strategy, so that we can establish, starting with the areas of training. Media practitioners are not mental health experts, and they may need, and they definitely need our input in terms of training on how to report on mental health, how to report on suicide, and therefore we must work closely with them and other interested stakeholders in ensuring that we develop these guidelines within our strategic plan. And some of these plans are already underway, and it will be great to for our NEC to actually prioritize actualizing a lot of the work that has also been planned over the past couple of years. And lastly, we must continue also to strengthen our position and our partnerships internationally. And so we'll also be looking into ways in which we can leverage our current partnership with the World Psychiatric Association and other international psychiatric associations like the APA. And to this end, I also want to thank the outgoing team, because for the upcoming conference, for example, we have the president of the World Psychiatric Association, Professor Helen Hamann, who will be addressing our conference. And that's a great win, and it means that we have a place to start. So I would like to end there by simply saying that this is another great opportunity where we find ourselves at a moment where we think about the next phase of leadership, and looking at a lot of positives that have happened and identifying new opportunities. I believe that KPA as an association is also at some sort of a crossroad, but the future, in my opinion, looks extremely bright, looking at even the capability of members who are still within the NEC. And although we have these 4 positions, we still have a number of positions that are not contested, like vice chairmanship, vice secretary, and NEC members who are still within. So they will have a lot of institutional memories. And so moving forward, our focus should be to quickly action the strategic plan, revisit and action it, and ensure that we are implementing it progressively, but starting as soon as we get into office. Thank you very much.
Thank you very much, Dr. Chitai. I'm sure we've all listened to him, and we've listened to all our candidates this evening. I'll ask Priscilla to read out the questions that probably that on a chat that members have asked, before we give an opportunity for any members to ask questions directly. Priscilla?
Okay, thank you for that. So we had questions to all panelists, and we had questions to specific people who are vying for the seat. So to the secretary position, question 1 is, how do you plan to sustain a vibrant secretariat?
Okay, thank you for that question, Dr. Priscilla. So the first way I want to sustain a vibrant secretariat. Now, a secretariat is first a service position. My job is to serve you members, to serve the NEC, and to also serve the general public in terms of mental health. So currently, the office admin or our office secretariat, she's called Esther. She reports to me, and I've been able to actually get some experience on how to handle matters of KPA. I spearheaded the acquisition of the computers and the hardware so that we can actually equip our office. Our office is now functional, and you can see we actually now really reminding members about subscription. We are also communicating much better than what we used to do. So the first thing I'll do as a secretary is of course, with the collaboration of my team members, is to develop a communication strategy so that we can be able to know how to communicate to our members optimally, whether it's using the emails, whether it's using the social media. So we'll be able to communicate to the members the way the members prefer. Secondly, by developing a communication strategy, we are going to increase our visibility, especially amongst the general public, to be the #1 go-to person or association for mental health matters. So we are going to engage the media, as Dr. Chitai mentioned, and be able to collaborate with them to be able to now spearhead all matters dealing with mental health. The second way I'm going to do that is by actually following the strategic plan. I was also honored to be part of the committee which was involved in the strategic plan at Brackenhurst, and we are able to actually develop a very good plan. So what we need to do with our new NEC officials is actually develop how we are going to implement that plan and how we are going to get collaborations and funding, because it's very heavy funding. It requires a lot of funding. Sorry. The next thing I'm going to do is actually now make our KPA online presence to be much more felt. We have a good website, so we need to actually now use it to actually further members' needs. So in case people need any research or any collaborations, we can post it there. In case of marketing, we can also market for you freely in the website and develop and be able to actually develop an online booking form for people to be able to see their clients either online or through physical meetings. Then thirdly, I'm also going to actually form or try with my NEC officials to form a welfare fund and also set up a welfare committee so we can be able to now be able to assist as an association where our members are in distress and be able to bridge the gap in all matters. Thank you so much.
Priscilla, I'll interrupt you. I can see Dr. Frank Jenga Senior's hand is up. Dr. Jenga?
Yes, is this a good time to ask a question?
Yes, please go ahead.
I have one comment and then two questions. My comment is that I had the privilege of watching the US debate between Trump and Biden. What I've heard today gives me confidence that we shall not go the American route, that we have men and women who are vying for positions, who are civilized, who allow each other to complete their sentences, men and women who have very clear visions about where mental health should be in the future. So my comment is that I am left with great comfort that whatever happens in this election, our association will end up better than it was, and certainly better than America will be. So that's the first comment. That's my comment. Now I have two questions, one to Dr. Wairoto and the second one to Mr. President. Dr. Wairoto, why is it that the elders are not present at the very least to hear today's debate? Is it that they were not invited? Is it that they find technology challenging? Why is it that the elders are not here in as large numbers as I would hope? My question to Mr. President, while congratulating you, Mr. President, I would like you to tell us what role do you see the elders playing, which is a corollary of what is the usefulness, if any, of institutional memory and history of our association, and how do you propose to harness that as we go forward? Thank you.
Right. Thank you so much, Dr. Jenga, for your question. So for this debate, election debate, the honors was on Dr. Priscilla Macau. She's the one who was doing the marketing and of the event. She actually sent the email to our members, I think a week before. We also roped in our office administrator, Esther, who also sent a reminder today to our members so that they can join in the debate. In future, I think what we'll do to rope in the seniors, we'll be doing a physical call or an SMS message to our seniors to just remind them that we are having a meeting so that they can be able to also join in and be able to give us their years of experience in terms of knowledge and their know-how. So this is a learning curve, and we are going to improve our communication strategy and platform from now going forward. Thank you.
Dr. Chitai?
Thank you, Dr. Frank Jenga, for being exemplary and attending this forum, and thank you for your questions. With regard to elders and institutional memory, first, I want to voice my recognition of the importance of that, and just the risk. There's a risk that we could repeat a lot of mistakes that have already been done in the past that can otherwise be avoided if we have a closer working relationship with elders. And we know that elders would be instrumental in areas of mentorship, areas of research, areas of strengthening collaborations with associations they have worked in and people they have interacted with, both locally and abroad, and even with government. And therefore, we recognize that, that elders have a role to play. What will be important for the National Executive Committee coming into place is to have this realization that elders have a role, and therefore, since they have a role, we must invite them and consult them when making decisions with regard to all the processes that will be happening. Should it be subcommittees in various areas? We involve the elders, ask them for advice, and to an extent, this has happened previously when we've been developing, documents such as the Constitution, such as the strategic plan, and so on. To an extent, it has happened, but we should be more conscious, that our elders have a big role to play in this association, and therefore, this is a challenge generally to all incoming members of the NEC and those who have been there before who still remain, that we must involve our elders. Thank you.
Thank you very much, everyone. I think we'll ask any final questions on the chat from Priscilla. Any final question before we wind up?
Yes, we had questions from the registrars. So one was to the treasurer, just like how will the registrars be supported or guided on how to get funds for the research work? And also another thing that was linking up with the registrars is to all panelists, I guess one can answer, how soon will programs geared to helping registrars finish the psychiatry program, as well as just make them big psychiatrists? When will this program start? Thank you.
In the interest of time, I am not sure we will have time. This was to run until 7:30?
Yes.
So I think we have 3 minutes. I'm not sure we'll get answers from all the candidates. I think we can agree to continue the conversation probably in our WhatsApp group for the remaining questions. Would that be okay with everybody? Because I think we only have 2 minutes to wind up. I hope that's okay. We can ask each of the candidates to give us just a 30 seconds, a parting shot, just one-liner. Each of the candidates give us a parting shot as we wind up. Mind you all, this has been recorded and it will be available The link will be available until the 12th of October before we have our voting on the 15th of October. So for those who have missed out at the start, you'll be able to listen to the whole recording. So can we have our candidates, just 30 seconds, each one of you, a parting shot. Who wants to start, or do I pick? Okay, Dr. Linda Nyamuta, parting shot. Linda. Okay, she's not ready. Dr. Edith Kwaba, parting shot.
Thank you, everyone. Please vote for Edith Kwaba for the CME coordinator for innovative, practical, and evidence-based CPD experience. Thank you.
Dr. Lawrence Nderi.
Good evening, everyone. Mine is to thank all of you for attending, and I pray that we shall be able working together to make KPA visible. Thank you.
Dr. Linda Nyamuta, available? Parting shot?
Dr. Linda Nyamuta, vying for CMA coordinator. Let's push KPA to be a more vibrant and more visible association. Thank you.
Dr. David Wairoto, parting shot?
Yeah, thank you, colleagues. Vote for David Wairoto for secretary. I'll be able to articulate, communicate, and advocate KPA's agenda. I have proven experience since 2017. Thank you.
Dr. Masi Karanja.
As the if appointed treasurer, I will ensure that we have strong internal financial control system and improve our resource mobilization in a transparent manner. Thank you.
And finally, Dr. Boniface Chitai.
I wish to thank you all for coming to this debate. It is the first of its kind, and it strengthens KPA as an association. For us to be stronger, we have to have members who are interested in the association, who are participating in the activities. And for now, we have an ongoing activity, the KPA Challenge. So please participate, do a video of yourself exercising, send it to us, and we'll caption it and share it. And through such activities, KPA will become stronger.
Okay, thank you everybody for your participation. This is a first for KPA. We have not had a debate before having elections for Kenya Psychiatric Association. So we are grateful for the organization. And I think as we wind up, I will ask Dr. Simon Njuguna to give us the final comments before we close. Dr. Njuguna.
Yeah, so good evening, members. I think this has been an excellent evening. I'm very grateful to all the candidates. I wish you well. And then for our members, I'm very happy that you have been with us. I've been happy to serve you for the last 7 years, starting as a treasurer and serving as a chair. And I'm hoping the team which is coming on board will do a great job. I invite you join us for the virtual KPA conference. Will be on 15th, and the same day later on, that is from 9 to 11, we'll have an interview session, which you'll be free to be neat or to leave out for a small break. Then you have the AGM, when we should be able to do the elections, which will be also virtually, and confirm the new NEC officials. So to everyone, bye, have a good day.
Okay, thank you very much, and good night, everybody.
Thank you, bye-bye.
Bye.
Bye-bye.
Bye.